Let's talk about the treatment of ankylosing spondylitis. Now, in order to treat the patient, there are variety of advices that can be given. One is the patient is counseled. Second, certain drugs are given. Now, the counseling part includes that patient must change his or her lifestyle that moves towards a more healthy one. There must be physical therapy. Over-the-counter therapies can be used, that the over-the-counter use of painkillers such as paracetamol, that can be used. There's the use of the prescription drugs that we will talk in the next slides. There's alternative medicine like yoga or acupuncture. Even that can be tried, and there is some evidence that it might relieve the symptoms of the patient. It will not treat the patient, it will not cure the patient, but it might relieve the pain and improve the quality of life of the patient. And in some very rare cases, even surgery is advised, but only in severe cases where the quality of the life of the patient is so much severely hindered that the surgical dissection of the vertebral column is performed. Next, we're going to talk about the pharmaceutical treatment or the prescription medicine. Now, the pharmaceutical treatment is that we give NSAIDs, that the non-steroidal anti-inflammatory drugs, or we give the anti-TNF alpha medication. Now, the anti-TNF alpha medication can include infliximab. Now, infliximab, as denoted by its ending three words MAP, is a monoclonal antibody. It can be adalimumab, it can be golimumab, or it can be certolizumab pegol. Now, infliximab, adalimumab, and golimumab. Now, all of these are prepared via recombinant therapy, but the certolizumab is prepared via humanized method. Now, because certolizumab is more humanized than the infliximab, the patient has less antigenicity or less reaction to these medicine than the infliximab or simple monoclonal antibodies. Now, it also must be noted that only infliximab is given via the IV route, while the adalimumab, golimumab, and the certolizumab are all given via the subcutaneous route. And because they are given through the subcutaneous route, there is sometimes risk of fat necrosis. Next, we have TNF alpha receptor blockers, and they can be etanercept. Last, we have the anti-interleukins. Now, these medications inhibit either the release of interleukins or inhibit the receptors via which the interleukins act. And these can be secukinumab. Again, it's a monoclonal antibody and it blocks the receptors of the interleukins. It can be ustekinumab. Now, both of these anti-leukin or anti-cytokine medications are not present in the market. They are in their third phase trial. They are being tested on humans. They are having some positive and promising results, but they are not present in the market yet. But they can be given to your patient through authorized randomized trials. Now, next for the treatment, we're going to talk about the dosage. Now, infliximab is given, like I said before, intravenously, and it is given 3 to 5 milligram per kg of body weight per week. Next, we have the etanercept. Now, etanercept is given subcutaneously and it is given 50 milligrams once weekly. Next, we have the adalimumab, which is again given subcutaneously in 40 milligram injection bi-weekly. That it is given twice a month. Next, we have the golimumab, which is again given subcutaneously, but it is given either 50 or 100 milligrams every 4 weeks. So there is less chance of both fat necrosis, and because there is so much delay and because it is also humanized, there is less antigenicity. So, among all the monoclonal antibodies, this one is considered the gold standard of the treatments. Next, we have the certolizumab pegol, which again is a humanized one and it is given subcutaneously and its dose is 400 milligram every 4 weeks. Again, it is given with a large duration, and so the chances of fat necrosis are again lessened. So this was the lecture on ankylosing spondylitis, where we learned about what ankylosing spondylitis is, what it means. We also learned about its pathology, how it happens, why it happens, and what is the cascade or the sequence of events which take place which results in the ossification of the vertebral column. Then we studied about its pathogenesis. Even though we do not know the exact cause, we studied that how both the TNF alpha, the TGF beta, and others take part in its pathogenesis along with the genes which are expressed. We also learned that how we can differentiate ankylosing spondylitis from other arthritis such as rheumatoid arthritis. Then we also learned about its diagnosis, how it can be diagnosed on different modalities such as MRI, CT scan, DEXA scan. Then we also learned about a certain example of a patient with sacroiliac. Then we learned about the treatment and how we give the treatment to the patient. We can treat the patient either by counseling the patient via changing the lifestyle and certain over the counter non steroidal anti inflammatory drugs, or via certain prescription drugs. And these prescription drugs are mostly monoclonal antibodies and they usually block the effect of the TNF alpha or the tissue necrosis factor alpha. And one such example would be the infliximab, which is very commonly given in a lot of different conditions, and it is also given in ankylosing spondylitis. So, thank you so much for watching sqadia.com. On sqadia.com, you can find lectures ranging from topics on biochemistry to physiology, from anatomy to pathology, from courses on radiology to surgery to medicine. You can find about any topic on Sqadia. So, thank you so much for watching sqadia.com.